How's it going? This is Andrew Simon for Technique Peak. Today I'm going to show suboccipital release slash stretch. This is really effective in patients that have suboccipital headaches, maybe some upper cervical tension. So what I'm going to do, you're going to start with the patient lying down in supine. Okay. And what you do, you're first going to palpate for the occiput. Now, when I use this technique, I like to make sure to use the pads of your fingers right here. We get underneath right here on both sides. All you're going to do, you're going to cradle the head. You're going to provide a little bit of traction. All right, so you want me to just get underneath there. I'm not digging in. So you just do a little distraction with the pads of your fingers right underneath the occiput. That feels okay, Gio? Mm-hmm. Okay. And usually I'll hold that for about 30 seconds or so. And then once the patient starts to feel a little better, another technique that you can then incorporate is you can then go in more towards the tips of your fingers like this, maybe for a more trigger point release technique. And what I can have you do, Gio, is I'll have you just nod a few times for me. So you're kind of just go up and down. Yeah. And again, this would be more of like a trigger point release technique. I'll have them do this for about, 30 seconds of just nodding back and forth. Relax. Okay. And then after you're done, as always, just reassess, ask the patient how they're feeling. So again, this is suboccipital release, suboccipital stretching. I'll use for some, cervicogenic headaches, upper cervical, spine issues. That's Andrew Simon with Technique Peak.